Dear Chairman, ladies and gentlemen, thank you for listening me. It's an important topic, and thank you for inviting me to this meeting. So my topic is now to talk about the role of the immunoglobulins. And if I would like to connect to the previous presentation, you can see that the natural IgM antibodies inhibit the microvesicle-driven coagulation and thrombosis. So there is a connection between coagulation and inflammation, even in the field of the immunoglobulins. Should we talk about the B cells? Well, I don't know, but it's more important to understand that the immune microenvironment define what will happen, because we have effector B1, B2, regulator B1, B2, and we have an induction cycle where the plasmocytes will be B1 effectors, and they communicate with T lymphocytes, Th1, and there is an amplifying circle, and we have the inhibitory circle. And all of these circles, indifferent is Th1 or Th2, it's an M1 or M2 response, according to the immunoglobulins, depend from the cytokines. The cytokines act on the B cells, and also the B cells produce cytokines. So basically, they have a regulation function, and finally, they are the factories for the immunoglobulins, the antibodies. Okay, but which is the most important role? In my opinion, is the immune modulation. Let's see the role of the IgA in sepsis. Well, they protect the lung and the GI system. It's the most abundant immunoglobulin. In one day, we produce in our body between 3 and 5 grams. And these grams will protect us against the microbiome, and when we inhale and exhale, protect the lung. And we have a monomeric form, and this is what we measure during when we do a lab measurement. And it's very important that it induces a pro-inflammatory response with the activation of the neutrophils. So the dimer form, it will cause a netosis during the neutrophils, and the IgA monomer form, it's a potent anti-inflammatory one. So what we can see here, a balance in the IgA. And there is a link between the gut microbiota and the neuroinflammation, which could play a role in the septic delirium. Why? Because our microbiome and also the pathological microbiome will produce neurotransmitters, neuropeptides at the local site. They communicate with these. And these neurotransmitters and neuropeptides we use in our brain for function. So if the levels start to increase, we could have a potential role in the septic delirium. However, the antibiotics lead to reduced IgA concentration in the lungs and in the intestine. Why? Because the microbiome is changed and the IgA production decrease, and then you will have in your patient after 2 weeks, 3 weeks, a pseudomonas pneumonia or a CDI infection. So the lung IgA production is directly dependent from the composition of the microbiome, which play a role in the ventilatory associated pneumonia. So the answer is that the IgA is the most commonly produced immunoglobulin, has anti-inflammatory and pro-inflammatory effect according to it is a monomer or dimer, regulate the microbiome in the intestines and in the lungs. And if we use it to play a role in the inflammation, then it goes on the neutrophils netosis. Okay, now come the question. Why do we measure only the sum of the IgA in our patients? Why we don't measure the monomer and the dimer levels to know from the sum what is the balance actually in my patient? Well, we should measure it. What is the role of the IgM in sepsis? In 2017, The Nobel Prize in Chemistry was given by cryo-electron microscopy. And this cryo-electron microscope can currently examine the molecules at the level of 2 angstroms. And we know that this means around 30 kilodaltons. And the pentamer IgM is about 1,000. So they checked the IgM with the cryo-electron microscope, and what they found that the IgM had 2 forms. When I was student and medical doctor, specialist, only I know that the IgM is a pentamer form. However, it seems that it has 2 forms, the pentamer and the hexamer. And 20% of the IgM is hexamer in your blood, actually, and 80% of the IgM is pentamer. And you can see that it's bited out a portion from the hexamer. What is its role? Well, here fits accurately the apoptosis inhibitor, the macrophage inhibitor apoptosis substance, which is coded CD5L. We know these, we measure these since 10 years, but these molecule fits in this part, in the pentameric structure where the gap is there. It's a cysteine inner chain interpreted by a G chain. And it has a connection with the lipid biosynthesis, because if you have more polyunsaturated fatty acids compared to the saturated, and here we have again a balance, then it will be produced or not produced, and you could have even at Th7 cells pathogenicity according to these. So if these levels are decreased in your patient, then converts the non-pathogenic Th17 to pathogenic one and play a role in autoimmune processes. We have evidence in neuroinflammation, but if you remember in the COVID pandemic, 20% of the patient had autoantibodies, which could be connected to the AIM. Since they developed the technique, they found minimum 250 function of the AIM, of the CD5L. They had very, very multiple roles. I not have time to go in the detail, but it seems that play a central role. And it seems that could be a promising biological therapeutic for treating sepsis, can become even a biomarker or a drug. Or I go further, because it has very, very good function, which helps us to recruit neutrophils, to activate them, to bind to the bacteria, to have the phagocytosis. But what is more important, there is an effective removal of the dams, which means that you will have less sterile inflammation in your patient, and your patient innate inflammation will be balanced more. And helps tissue repair in acute kidney injury, in acute liver injury, in septic myocardiopathy, in acute lung injury, and even in septic encephalopathy, restitutio ad integrum. And I think that in the next 10 years, my mother, my wife, or my daughter will have an ointment with CD5L as well in cosmetics. So, the IgM, it has 2 forms, the penta and the hexa. They come from different cells, the B and the B2 cells. And the pathological IgM, which is the hexa, is the infectological active one. And the immunological active one comes from the B1 cells, and it's called the natural IgM. And the natural IgM regulates the inflammation, the AIM levels, and through the AIM levels, the inflammation. Even we know the normal range of the CD5L according to the gender. So neutrophil recruitment and activation, influencing the macrophage response from M1 to M2, the Th70 response from pathogenic to non-pathogenic, and reduce the DAMP-induced inflammation. So the answer is that the aim is the CD5L antigen. It's immunomodulator. And the natural IgM regulates the immune response, and the pathological one plays a major role in the infection. However, what happens in your patient? If these 20% of the pentameric form is consumed, you start to consume the hexameric form is consumed, you start to consume the pentameric one, and then your patient will lose the immunomodulation, and your inflammation will be more dysregulated. Why we don't measure on daily basis the levels to check the kinetics of the aim, I mean CD5L or IgM, pentameric and hexameric levels? It could be important because then we understand the role of the immunoglobulins in our individualized patient, and we can apply this treatment more accurate. What is the role of the IgG? Well, we have many roles. We know that they play a role in autoantibody neutralization. We have evidence mainly in neurological diseases. And why? Because they reduce the antibodies based on that these antibodies must enter in the cells by pinocytosis, and they get in endosomes, and these endosomes, the lysozyme enzyme can destroy them. And if you use IgG treatment, then the normal IgG will use these receptors, and the pathological autoantibodies will be lyzed by the cells. This is an acceleration of IgG catabolism by saturation of this receptor, and inhibit the complement binding, so it prevents the membranolytic attack complex, which is quite important, and it's related to the link between the immunoglobulins and the complement. Reduce the pathogenic cytokines and other immunoregulator molecules, and they modulate or block even the factor crystallized receptor on macrophages, and this can be transduced in activating signal or inhibiting signal, and it helps in dendritic cells differentiation and maturation with the costimulatory molecules to reduce the cytokine secretion, play a role to reduce your cytokine storm, and also at the CD4 antigen recognition. So the answer is that IgG can modulate the activation and the effector function of the B and T lymphocytes, can help us to neutralize pathogenic autoantibodies, in my opinion, even in bacterial sepsis, not also in a viral sepsis as the COVID. These autoantibodies could be present in some patients, but we did not measure them, and could be phospholipid syndrome, and you could have also mycothrombosis because of them. And reduce the antigen presentation. It has a strong anti-inflammatory effect by interaction with the complement system, the cytokines, and the endothelial cells. We don't check the IgA-IgM ratio. We don't check the IgM-IgG ratios. Maybe it could help us to understand these dysregulated immune responses in our patients. And basically, if you think about it in your department, I don't think that in the last time in a septic patient you check the lab because of the autoantibodies in severe multi-organ sepsis. These adjunctive therapies in sepsis are important, but usually the immunoglobulins are in the top. You should do the resuscitation, the source control, the oxygen organ support, and so on. But if we are able to measure the aim, and we are able to distinguish the IgA mono or dimeric form or the penta and hexameric form in the future in all patients with infection and sepsis, we will step forward, and based on that, we can understand the immunomodulation, even can treat better in an immunomodulatory mode or patients, and could reduce the mortality and comorbidities after sepsis. Even could be a topic to the next meeting of sepsis or STAR to talk about, to check the literature, to talk about our measurements in our septic patients. Why not? Thank you so much for your attention.